America is facing a full-scale health emergency. More than 70% of adults are overweight or obese. More than half are diabetic or pre-diabetic. Chronic disease touches nearly every single American family. This did not happen by accident. It happened because real food was pushed aside, replaced by highly processed products. Junk food became the foundation of the modern American diet, and we're paying the price with our health. But that ends today. We are resetting how our nation eats. Real food is back at the center of the American diet. Real food that nourishes the body, that restores health, that brings back energy, and that builds strength. This is what it takes to make America healthy again. Under the leadership of President Trump, we are reclaiming the food pyramid and fixing a system that has been broken for far too long. Today, HHS Secretary Robert F. Kennedy Jr. and USDA Secretary Brooke Rollins introduced the most significant change to federal nutrition guidance in the history of this nation. This is the new pyramid, Dietary Guidelines for Americans, a national reset built on real food.
Good morning. Who is hungry for a new food pyramid? Well, how about it? It's time to talk about school lunch programs, not just putting 6-year-olds on Ozempic. We announced this yesterday at the White House briefing room, and already in 24 hours have had a tremendous response, a national conversation about what kids eat at school boards, in houses of worship, military bases, and in the SNAP program. And we want this conversation to keep going. Today is day 2. We want it to keep going. I want to thank all of you who are here, a lot of familiar faces, who are here because you believed in Secretary Kennedy's vision to put food back in the center of our healthcare system. This is health reform. This is a component of health reform, and a powerful one. It's been ignored for a long time. If you haven't noticed, American nutrition has had a rough last 50 years, driven by bad advice and misinformation from medical dogma, from the establishment, and from the United States government. Today and yesterday, we are setting the record straight, telling people the truth about food. The last 50 years has been dominated by medical dogma, really around one concept: a myopic focus that there was one boogeyman in the food supply: natural, saturated, healthy fats. And if you avoided them, that was the secret to better health. Well, as we kept saying this, the entire food supply moved to refined carbohydrates and ultra-processed foods. And what did the medical establishment do? Double down. Avoid more fat. Consume less fat. And it was the same message. as we watched a ballooning epidemic that now affects 40% of American kids: obesity, diabetes, other health problems. You know, the propagators of this dogma tried to prove their theory correct. In the 1960s, the colleagues of Ansel Keys tried to do the end-all study that was going to once and for all prove that it was saturated fat that was causing our problems in health. A randomized controlled trial of over 9,000 people, randomizing them to a low-fat diet. And in the end, the low-fat group had higher rates of coronary heart disease and heart attacks. Wait a minute. It's the opposite of what they were finding. They suppressed the data for 16 years. 2 other large studies failed to show an association. Finally, the study trickled out in the medical literature. Nobody noticed it. Those on the low-fat group had higher rates of heart attacks. Why? Maybe because when you avoid fat, you have to pound food with carbohydrates, and often ultra-processed carbohydrates stripped of fiber and chopped up. It functions like sugar. We created a generation of children with low protein, high carbohydrates, sugar addiction, and burdened with ultra-processed foods. And what did we do as a medical field? Drugged them at scale. Those days are over. We are telling people the truth about food. It's not right. And when the senior author was asked, why did you wait 16 years to publish the largest end-all randomized trial on saturated fat, he said, quote unquote, "We were just so disappointed in the way it turned out." That's not the way science is supposed to work. We're supposed to seek the truth and ask questions, not accept dogma. But nowhere in my medical education was I actually taught the truth. Same for Jay Bhattacharya, Mehmet Oz, and the other physicians, Brian Christine. I was never taught the truth that you can make some forms of skin eczema disappear by changing what you eat, that you can cure most type 2 diabetes by changing what you eat, that you can improve your gut health and mental clarity and memory by changing what you eat. Those are principles that we know to be true, that clinicians have observed, that we just don't hear about. Today, we are setting the record straight. The old system that a pill for everything is going to solve our health problems is no longer the framework. We are getting back to the root causes of our healthcare chronic disease epidemic: insulin resistance, general body inflammation. We are addressing the low protein recommendations, increasing those by 50 to 100%. We shouldn't be having protein recommendations in the dietary guidance, as we found when we came to office, that prevent muscle wasting and withering away. We're not trying to prevent kids from withering away. We want American kids to thrive, and we're going to give them the protein recommendations. We really wouldn't be here talking about this with such national support. Even the critics are saying this is one thing they got right. Getting away from the corporate interests. You know, we have a charge from President Trump: do what's medically right and don't worry about the lobbyists. And that's what we did. That's what we did. People of all different political persuasions all say, you know, when it comes to Bobby Kennedy, I love what he's doing on food. And Bobby, we love what you have done to lead us on food. Thank you for being the leader. At a time when social media and affirming news tries to divide us, there's a topic that unites every mom and dad out there in the United States, everyone trying to take care of their parent, everybody who looks at this topic with any degree of objectivity, and that is we need to right the ship when it comes to our dietary guidance and literally turn the food pyramid upside down. Brooke Rollins, you have been the perfect partner in this. And I believe you will go down in history as one of the great leaders in reforming our food supply in the United States of America. USDA is a huge part of this. So I want to thank everybody who's here. You're going to hear from a bunch of folks, but most of all, I want to thank everybody here who has believed in this message and has broadcast it before we even took this on and came to office, and that's why we're here today. So with that, I'll introduce our Secretary of Health and Human Services, Robert F. Kennedy, Jr. Thank you, Bobby.
Welcome, everybody, and I want to start by thanking my friend and colleague, Secretary of Agriculture Brooke Rollins, who you're about to hear from. Brooke understands that good food policy is good health policy and good farm policy. Our partnership represents an historic collaboration between HHS and USDA, one that finally aligns the prosperity of our agricultural system with the health of the American people. And when we were sitting backstage here, Brooke was talking about all of the great publicity that we've gotten on this announcement yesterday, which has been extraordinary. And she said, it's the first time I've had good publicity. I don't really know how to handle it psychologically. But it has been wonderful. The one voice against us has been the American Heart Association. And interestingly, Marty McCary wrote a book about the war on saturated fats. And I urge people to go and read that chapter to his book, which is called Blind Spots. It's an extraordinary saga, and it is kind of a template for how scientific consensus often orients around one bad study that then becomes the dogma. And that it's something that's really bad for you, and yet the scientific establishment, there's a big difference between established science and the scientific establishment. And the scientific, we all know that experts, trusting the experts is not a feature of science. It's not a feature of democracy. It is a feature of tyranny and a feature of religion, but not science. In science, you question everything. And, we were told for 3 years during COVID, trust the experts, but that is not science. Science is eternal skepticism towards all orthodoxies, understanding that people in authority lie, and that there's all kinds of conflicts of interest that drive the creation of orthodoxies and dogmas around bad ideas. And that in a democracy, we have a responsibility to become the CEOs of our own health, to take charge of it. It's a big responsibility. It's a responsibility people maybe in other countries don't have. But it's something that is a burden that's put on each of us. And we all need to question what we're told. And this war on saturated fats is a really good example. And again, I urge people to read Marty's book, but one of the big villains in that chapter is the American Heart Association, which it was and continues to accept millions of dollars on the biggest processed food makers in this country. And then given us and supported and fortified a dogma that vilified and demonized good food and implicitly then bolstered the economics and mercantile ambitions of the processed food makers that were providing its funding. And these are the conflicts of interest that all of us, Marty and Jay and us and everybody in this agency, came in to end those conflicts and to expose them. And it's important that the American people know that sometimes they're getting medical advice from people who have an economic stake in that advice. And we have a responsibility to question that. I'm also grateful for all the people attending today, including SBA Administrator Kelly Loeffler, National Advisor for Nutrition, Health, and Housing, Dr. Ben Carson, USDA Secretary of Agriculture, Stephen Faden, member of the Maha Caucus, Senator Ron Johnson, a huge advocate for us, and Chairman of the House Committee on Agriculture, Glenn Thompson, Senate Maha Caucus Chair, Senator Roger Marshall, another great friend and advocate, House Maha Caucus Chairs, Republican Lloyd Smucker, Anford Buchanan, Chairman of the Republican Policy Committee, Representative Kevin Hearn, Chairman of the Republican Study Committee, Representative August Pfluger, Chairman of the House Appropriations Subcommittee on Agriculture, Andy Harris, and Representative Nick Langworth, and the many executives of the food companies and major associations who are here with us today. Today marks a revolutionary change in federal nutrition policy made possible